Hello, I'm Emma Green, the tennis elbow queen and host of the Your Healing Team podcast. In this short episode, I am going to talk all about tape, specifically for tennis elbow. However, many of the principles that you will hear me talk about in this episode can be applied to other areas of the body. So without further ado, what does the research show with regards to taping and tennis elbow? Well, first of all, what is tape? There are many different types of tape out there. The most commonly known would be athletic tape, which is a rigid tape. It's sticky on one side. It's rigid. You can see this applied on many athletes, particularly football players. People like that tend to use a lot of athletic tape. Now, there are other types of tape that are a little more stretchy. There is adhesive elastic tape, which is similar to athletic tape, but where athletic tape is rigid, the adhesive elastic tape, obviously in the name, it's elastic, it's got some stretch to it. Now, both of these types of taping were very common sort of 25, 30 years ago in the sports arena. And since then, maybe 20 years ago, tape, K-tape started to make an appearance on the scene. And this is also a stretchy tape, although it's multi-directional stretch. So the elastic adhesive tape tends to have stretch longitudinally along the tape. Kinesio tape has stretch multi-directionally. Now, the big thing with something like kinesio tape, and I will use the term kinesio tape, but this can be applied to rock tape. It can be applied to any of the other brand names that are of the same multi-directional stretch tape. The big difference with these types of tape is the way that the glue is applied to the back side. When we talk about adhesive tape or the rigid athletic tape, the adhesive is just uniformly applied to the back. With kinesio tape, the glue on the back is into wave formation. If you look at the back of it, you can see the glue is in this different type of formation. Now, the reason for that is the way that the tape works. The theory behind it is this wave pattern in how the glue is applied to the tape actually helps to lift up the layers of the tissue, which encourages free flow of fluids underneath the tape. That's one of the features of kinesio tape, one of the differences between regular taping and kinesio tape. So it is quite a specialized tape. Now, why is that important? Well, if you can lift up the different layers of the tissues, you can get this free flow of fluid. It helps to decrease swelling. I've seen it work incredibly well on swelling around the knees and ankles, joints that typically do swell a lot. If we're looking at tennis elbow, we don't see an awful lot of swelling there. So with a typical tennis elbow, there's not going to be a lot of swelling. So you're not really going to be utilizing that particular feature of the tape. However, the other thing that the tape can do, it can inhibit muscle action, or it can increase muscle action, sort of excite the muscles. And that can make the muscles work faster and quicker, or it can quieten them down. One of the big problems in tennis elbow is muscle tension in the forearm muscles. If you've got a lot of tension in the forearm muscles, if those muscles are really tight, they're going to pull on the tendon. That's going to hurt. You're going to feel that tendon more. So if we can apply tape to the forearm muscles to quieten the muscles down, that can have a beneficial effect. You can feel better. It can give you some pain relief. The thing to remember with all types of tape is you can't slap a piece of tape on and it heals the tendon. It doesn't work that way. However, it can give you some pain relief. And obviously that's a good thing. We want pain relief. And if you've got pain relief, then you can continue to do the other things that you need to do in order to actually heal the tendon. So it can be helpful from that perspective. Now, what does the research show us? The research shows that yes, you can get some of these pain relieving effects with tape. It generally occurs in people who haven't had tennis elbow for that long. A lot of the research was on people who've had tennis elbow for 2 or 3 months. So that's the earlier end of the scale. However, if you're somebody who has tried tape and it seems to work for you, keep doing it. That's completely fine. Don't think you have to stop. The main considerations that you need to be aware of when using, well, any kind of tape, really, are twofold, particularly. First and foremost, if you get any kind of skin irritation, take it off. If you're feeling itchy underneath the tape, or it's feeling burning or just uncomfortable in any way, if it increases your pain, it's not right for you. Take the tape off as soon as possible. If you are using one of the brands of Kinesio tape, KT tape, Rock tape, whichever one, some of them have sticky adhesive. So the glue on the back is stickier with some. Kinesio tape tends to be much kinder. I think they even do a brand that is specifically for more sensitive skin as well. I would definitely go for that if you do have sensitive skin. If you are an athlete, if you are playing, if you're sweating a lot, you're going to need something with a little bit more stick to it. The regular Kinesio tape is probably just going to come off. Rock tape is definitely more sticky. And I think they even do a super sticky rock tape. When I did my training on using Kinesio tape, we used the Rock tape brand. I had it on for about a week because you can leave it on that long as well. It's not something that you need to keep taking on and off. So I'd had it on for about a week because I wanted to feel what it's like for my patients who are having it on for that length of time. And even after that length of time, it was still really well stuck, and you got to be careful taking it off. Don't just rip it off like you would a Band-Aid or a plaster. Be very, very cautious with it. You want to really protect your skin, because if you damage your skin in any way, you're not going to be able to reapply the tape until your skin is healed. You're also not going to be able to do the heat or the ice if you need it. You are going to slow your healing process down if you damage your skin. It's super important that you don't damage your skin. After you've taken the Kinesio tape off, a top tip I got from a really amazing certified hand therapist that I worked with for a long time. She said, put a little bit of milk of magnesia on the skin, just rub that over. I'd never heard that before, but apparently it works wonders. So a little bit of milk of magnesia can really help to protect the skin so that when you reapply the next time, you're just making sure that we're not getting any of those negative skin effects. The other thing that I want you to be aware of with the tape is that when you put something external on like that, particularly if we're using it to decrease the muscle tension, the way that you decrease the muscle tension is you kind of switch the muscles off. And whilst that's good because then it doesn't pull on the tendon, you feel better, the muscles are going to be weakening if we keep switching them off. A little bit like if you're using a brace. If you put anything external on, the muscles underneath switch off, and then you are going to get a weakening effect. Ultimately, we need to strengthen you up. So using these external things too much and you get too much of a weakening effect, then you've got to start strengthening from a much lower point than maybe you would have had to. So just bear those couple of things in mind. But if you're really struggling with pain, it's absolutely worth trying. If you're working with a physical therapist or a physiotherapist, ask them about it. They should be able to help you with this, about how to apply it, and give you some good advice with regards to that. I am going to put some links in the description as well of the particular types of tape that I have used in the past, and particular ones for different skin types. So you can check those out and see which works best for you. But if you have any questions, please don't hesitate to reach out, and I will see you on the next episode. Take care. Bye.